Hello all, I am Dr. Nitesh Narayen, Lasik, cataract and corneal surgeon working at Win Vision Eye Hospitals. Today I will be sharing some of my thoughts on LASIK surgery. The commonest question asked is what is LASIK, how, when can they undergo this LASIK surgery. Basically LASIK stands for laser assisted keratomiliosis. So basically with the help of laser we are reshaping the cornea so that you can get rid of your glasses. Any person who is more than 18 years of age can undergo this LASIK surgery. Why we say 18 years is because after 18 years of age, the chance of power increasing is very negligible, and that is the time when you can plan LASIK surgery. So there is no upper age limit for undergoing this surgery. So we have operated for a patient as old as 55 years as well. And why do you have to undergo this surgery? It is not a compulsion, but basically LASIK is a cosmetic procedure. So suppose you are not very comfortable with glasses or you are not very comfortable wearing your contact lenses, then you can definitely plan this surgery. The next question they ask is what are the complications associated with this surgery? I tell this to all my patients, no surgery is 100% safe, and the same thing goes with LASIK surgery. But provided you do proper necessary investigations preoperatively and take proper precautions during the surgery and proper precautions after the surgery, you can have a very good visual outcome in these surgeries. LASIK, when you say, it is the most commonly performed surgery worldwide, and when you compare the risk of complications which can have with other surgeries and you compare this with LASIK surgery, they are very. Next is how much time does a surgery take and what is the recovery period after LASIK surgery. Normally we operate both eyes at a time, one eye after the other. It takes on an average 15 to 20 minutes for the entire LASIK procedure, and the recovery period is very minimal. On the day of surgery you will definitely have slight blurring of vision, but from the very next day you can go back to your work, and you have to use drops as prescribed by your doctor, and you need to maintain proper hygiene around the eyes. What are the complications which one can expect after LASIK surgery? As I told you before, the kind of complications which you can develop in LASIK surgery are very negligible, and you can avoid them by taking necessary precautions. The two most common complications which are reported in literature are infection and post-LASIK ectasia, or the power can come back after LASIK surgery. To prevent infection, we give antibiotic drops before surgery, and the doctor also tells you to use antibiotic drops after surgery, and you need to maintain proper hygiene around the eyes for 1 week post-operatively. Coming to post-LASIK ectasia, which is one of the most dreaded complication for any refractive surgeon, it can be avoided by doing proper preoperative assessment of the cornea. So post-LASIK ectasia basically is the amount of power which you have corrected can come back. So proper op scan or pentacam, where we do a complete evaluation of the cornea to know that whether you are suitable or not for LASIK surgery, can help us in avoiding this dreaded complication. They ask what are the various kinds of LASIK surgery available. So basically when you see the procedure in LASIK surgery, you make a cut in the cornea at a depth of say 100 or 120 microns. You make a flap out of it, and then whatever power you have is just shaved off on the cornea, and then the flap is put back. So for cutting the cornea, for making the flap, you have two techniques. One is either you can use a blade, which you call it as a microkeratome assisted LASIK, or the second is the femtosecond laser assisted LASIK. So basically with femtosecond laser, you use a femtosecond laser to cut a flap, and then you use LASIK or laser surgery is then used to correct your power on the cornea. There are different kinds of LASIK treatment available. So how do we choose which kind of treatment is suitable for your eyes? See, basically broadly speaking, there are two kinds of treatment, where one generally is used to correct your entire power of the cornea of the eye. The second treatment is, apart from your power, we can also treat some amount of aberrations which are there on your eye. So these aberrations in common man language help you in having a better clarity of vision post-operatively. So you have two kinds of treatment, the wavefront guided and wavefront optimized treatment. So the neo treatment or the contour treatment which we have at WinVision corrects your power and also treats your existing aberrations so that you have a better quality of vision post-operatively. The study done in US by the FDA has shown that almost 30% of the patients who had undergone contour treatment or the wavefront guided treatment had a better quality of vision post-operatively. If the patient is not suitable for LASIK, then what are the other options available for that patient? So normally speaking, out of 100 patients, 30 patients are not suitable for laser surgery. So these kind of patients can opt for two other treatments which are surgically based treatments. One is PRK, the other is phakic implantable lenses which are placed inside the eye. So how PRK is different from LASIK is, in PRK we are ideal for patients who have low powers and who have borderline pachymetry. When I mean to say borderline pachymetry, in LASIK, as I told you, two investigations are very important. One is the thickness of the cornea and second is the curvature of the cornea. So the thickness should be more than 500 microns. So for patients whose thickness is less than 500 microns but it is more than 480 microns and whose power is borderline, can opt for PRK treatment. In PRK treatment, we don't lift the flap but we directly apply laser or do the laser correction on the cornea. So the disadvantage with PRK is you don't have a very good vision the very next day, unlike LASIK surgery, but 1 week or 10 days down the line you can have a very good visual outcome in PRK as well. But they are only suitable for patients who are low powers, not very high powers, low powers, and who have borderline pachymetry can opt for PRK treatments. And coming to patients who has higher powers and who are not suitable for laser surgery, any kind of laser surgery that is not PRK and LASIK, those kind of patients can go for permanent contact lenses implantation which are placed inside the eye. For doing permanent contact lenses, we look at the depth inside the eye. The depth should be more than 2.8 millimeters, which we can do measure by doing some investigations on the eye. And patients who are suitable for LASIK, not suitable for LASIK, can opt for permanent contact lenses implantation. Patient asks how long does the visual correction last and will they require any glasses after surgery. Once we do laser correction, normally it lasts your entire lifetime. So suppose you undergo surgery at the age of 20 or 25, for the rest of your life, say around 55, 60 years, you will never require glasses for distance vision. But after the age of 40, which everyone reaches that age, will require reading glasses, which we call it as presbyopia, chatvaram antam. So with that, you will require reading glasses, but for distance you would not require any glasses after undergoing any LASIK surgery. There is a very small possibility where some amount of power can come back, which usually happens in very high powers, high myopes. And how frequently should we undergo eye checkup after LASIK surgery? Ideally speaking, you have to undergo eye checkup every year, whether you undergo any kind of surgery or not. But after LASIK surgery, it is preferable to undergo a complete eye examination, which includes a dilated eye examination as well after LASIK surgery.